Kebidanan Bhakti Nugraha. Pada 25 Maret 2019, ke-10 sekolah tinggi tersebut ditetapkan menjadi Universitas Bhakti Kencana, atau yang biasa disingkat menjadi
Hello, is my voice heard? Hello? Good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Welcome. Welcome to the International Guest Lecture event in collaboration with Lincoln University. I am Jihad Antar, your host for today. I would like to extend my greetings to the Rector of the University, Dr. Apoteker Entri Sutrisno MHKes, and the Dean of Faculty of Pharmacy, Dr. Apoteker Patonah MSc. Well, participants, for the next 3 hours, we will collectively delve into the topic of today's event, which is recent advances in herbal medicine for syndrome, metabolic, and infectious disease. Ladies and gentlemen, allow me to present the agenda for today. The first item on the agenda is the opening session, followed by singing the national anthem and the Mars and hymn of Bhakti Kencana University. Afterwards, we will move on to speeches, starting with a message from the chair of the committee, Dr. Apoteker Herni Kusriani, MSc. Following that, we'll watch a short clip highlighting our faculty profile, followed by a speech from the dean of the faculty. A photo session will then take place, leading us into the main event, the seminar session featuring our distinguished speaker, Professor Dr. Satheesh Babu Natarajan, guided by our moderator, Ms. Apoteker Widya Aligita, MSc. This will then be followed by a discussion session, and we will conclude with the closing remarks and door prize announcement. Well, without any further ado, let's commence with the singing of the national anthem, the Mars and the hymn of Bhakti Kencana University.
berinovasi, berkarya kreatif dan berprestasi. UBK abadi sepanjang masa. Maju melangkah bersama UBK, mandiri, unggul, berdaya saing, dengan rasa bangga kami baktikan ilmu amal untuk negara, mencetak insan muda berprestasi untuk bangsa negara, laksanakan tugas tridharma, ciptakan generasi berinovasi, berkarya kreatif dan berprestasi. UBK abadi sepanjang masa.
That was the national anthem, Mars and Hymn of Bhakti University. Well, moving on to our next agenda, the first speech will be presented by the chair of the committee, Dr. Apoteker Herni Kusriani, MSc. Miss, are you here?
Okay. My sound is clear?
Yes, it's clear. Time and place is yours.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Best wishes for all of us. Ladies and gentlemen, esteemed guests, Dr. Apoteker Menteri Sutrisno, as Rector Bhakti Kencana University, Dean of Faculty of Pharmacy, Dr. Patona, Head of Study Program in Faculty of Pharmacy, Mrs. Ika Kurnia Sukmawati, Master of Science, Pharmacy Diploma Study Program, Bachelor of Pharmacy Study Program, Mr. Ari Suhardiman, Professional of Pharmacist Study Program, Dr. Dadang Juanda, and the Master of Pharmaceutical Study Program, Dr. Garnadi Jafar. Lecturer at Bhakti Kencana University and passionate learner, welcome to International Guest Lecture. I'm thrilled to stand before you as the organizer to this educational extravaganza. Our goal is to inspire and foster an environment where learner knows no bound. This program is to implement our collaboration in the field of education between Lincoln University and Bhakti Kencana University. Thank you very much to our guest lecturer, Professor Dr. Satheesh Babu Natarajan from Lincoln University, and he is the expert of the herbal medicine and nanomedicine. Get ready to take a part of the interesting presentation by Professor Satheesh. Inside his share the expert patient for the recent advance medicine for metabolic syndrome and infectious disease. Then I would like to thank to the all committee members that involved in this program. So without any further ado, let's begin to join this nice lecture. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Miss, for your warm welcome. Before we proceed to the next speech, let's take a moment to view the profile of the Faculty of Pharmacy.
Bandung City is the largest metropolitan city in West Java Province. Bandung is also known as the city of education, which has scientific interests and has enough universities. One of them is Bhakti Kencana University. Bhakti Kencana University is located at Soekarno-Hatta Street number 754, Bandung. Established on the 25th of March 2019, which is a combination of 10 universities that are directly under the Adiguna Kencana Foundation and has been inaugurated by the Minister of Research Technology and Higher Education, Professor Dr. Andes Haji Muhammad Nasir, AK Magister Science, PhD. In the vision of Bhakti Kencana University to become an independent, superior, and empower higher education institution to improve the quality of life of the Indonesian people, then we need a mission that is able to support so that the vision can be realized. 1. Developing institutions in the context of realizing independent universities with standardized national and international quality management systems. 2. Build and develop the quality of education in implementing the three dharma of university in the fields of teaching, research, and community service. 3. Optimizing the creative and innovative capacity of the academic community. 4. Creating an entrepreneurial university that plays a role in improving the quality of life of the nation. Bhakti Kencana University has 4 faculties, which include the Faculty of Pharmacy, Faculty of Nursing, Faculty of Health, and Faculty of Social Sciences. The range of study programs over ranging from diplomas, bachelor, and also professions, has proven to be able to produce graduates with superior quality in the community. For more information, please call 08131 2221 255 or visit our website at bku.ac.id or our Instagram at bku.campus. Bhakti Kencana University, from us for public health.
Okay, that was our company profile. Moving on to the next agenda, the second speech will be delivered by the Dean of the Faculty of Pharmacy, Dr. Apoteker Patana MSI. Ms. Patana, are you here? Yes.
Yes.
Time and place are yours.
Yes. Okay, thank you. Lihat. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Good morning, everyone. How are you today?
Fine.
Good morning.
Thank you. My respected Rector of Bhakti Kencana University and the faculty members of pharmacy, our student of pharmacy, Bhakti Kencana University. I hope this message finds you well. Today is a special day as we gather virtually to welcome this distinguished guest, Professor Satheesh Babu Natarajan. I'm sorry for the mistake, if there is mistake in spelling. Okay, to our Zoom lecture on recent advances in herbal medicines for metabolic syndrome and infectious disease. We are honored to have Professor Natarajan with us, and I extend a warm welcome to everyone joining from Faculty of Pharmacy, both of Bhakti Kencana University and maybe from Lincoln University. Let's start. Professor Natarajan is an esteemed scholar whose work in the field of herbal medicines and has significantly contributed to our understanding of its application in addressing metabolic syndrome and infectious disease. Okay, before we dive into the lecture, I want to express to our gratitude to Professor Natarajan for sharing their expertise with us today. As I encourage all of the participants to actively in the discussion, ask the question, and engage with material being presented by Professor Natarajan. Now, let's start the lecture. Please, Professor Natarajan, thank you for being with us today, and we look forward to gaining valuable insights from your lecture on recent advances in herbal medicine for metabolic syndrome and infectious disease. Welcome, and please join me in welcoming Professor Natarajan. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning.
Thank you so much, Ms. for the insightful remarks. First, before we go to our main event, let's take a group picture. So please value participants to open your cam. Okay. We have quite a few slides here. We'll wait. Please open your camera so we can take pictures. Okay, valued participants, we'll wait. There are a few slides in here, 20 slides. Maybe Fareza? Yes? Okay.
Okay, thank you, Jihad.
Yes. go
Okay,
on.
please, all participants to open the camera. Yeah. Okay, slide 1, 1, 2, 3. Slide 2, 1, 2, 3. Slide 3, 1, 2, 3. Slide 4, 1, 2, 3. Slide 5. Slide 6. Okay, thank you, Jihad.
Okay, thank you so much, Fareza. Okay, now valued participants, we will transition to the highlight of our gathering, the presentation by our distinguished guest lecturer today, Professor Dr. Satheesh Babu Natarajan. He holds the position of professor in the Department of Pharmaceutics at Faculty of Pharmacy in Lincoln University in Malaysia. Facilitating our discussion as the moderator for today is Ms. Apoteker Widya Aligita MSE, a dedicated lecturer in the Faculty of Pharmacy at Bhakti, Kencana University. Well, before I pass the floor to our respected moderator, I kindly remind everyone to focus, take notes, and engage, as there will be door prizes awarded for selected questions. But the door prizes are limited to Bhakti Kencana University students. Well, without any further delay, I extend an invitation to Ms. Widya to guide us through this insightful session. Ms. Widya, are you here? Yes.
Yes, thank you, Jihad.
You're on, Ms.
Is my voice clear?
Yes, it is clear.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all the participants, the Honorable Dean of the Faculty of Pharmacy and the lecturers, our speaker from Lincoln University College, Malaysia, Professor Dr. Satheesh Babu Natarajan, and all the participants. Ladies and gentlemen, I am Widya Aligita. It gives me a great pleasure to be the moderator for the international guest lecture with the topic today, recent advance in herbal medicine for metabolic syndrome and infectious disease. As we all know, Indonesia is rich in natural resources, particularly the natural medicine. Some of these plants, we have known that it has many pharmacological properties and have been used empirically for a long time. And in today's guest lecture, we will get a closer look into the potential and development of the herbal medicine in treating metabolic syndromes and infectious disease, particularly those associated with diabetes mellitus. And for today's speakers, I would like to read a brief introduction to our speakers. Professor Dr. Satheesh Babu Natarajan. He is the professor from the Lincoln University College with teaching and research experience more than 10 years. We can imagine the expertise of Professor Satheesh, and his specialization is in pharmaceutics, and up until now, he is served as the head of the department in the Department of Pharmaceutical in Lincoln University College. And his research is mostly exploring about the herbal medicine. And since his specialization in the pharmaceutics, He is also exploring about the formulation, especially in the nanomedicine and the targeted drug delivery system design. And before the presentation begins, let me tell you how this event will run for today. Firstly, the Professor Satheesh will present the material for about 16 minutes. Following that, we will have a question and answer session for about 15 minutes. And finally, the session will be ended by a conclusion. And without any further ado, ladies and gentlemen, now allow me to welcome Professor Dr. Satheesh Babu Natarajan to present the material for the recent advanced herbal medicine for metabolic syndrome and infectious disease for about 16 minutes. Professor, the time is yours. Please. I'm sorry, Professor, the sound is still mute.
Can you hear me, Prof?
Yes, please, Professor.
Hello?
Yes, I can hear you clearly.
Can you hear me, Prof?
Yes, please, Professor.
Thank you, Prof. Thank you for your warm welcome. Good morning to all the dignitaries, the directors, deans, faculty members, and my dear students. Good morning to everyone. So today I am going to present the wonderful topic that is recent advances in herbal medicines for metabolic syndrome and infectious diseases. I hope you can see my slides.
Yes, it's good.
We can see your slides, sir.
Just a minute, because please hold on, because the slide cannot.
Maybe it's still loading. It's okay if you can't the to slideshow the presentation. It's okay, Professor.
This one okay?
Yes, it's
Visible?
okay.
Okay. Thank you, Prof. Appreciate for your kind cooperation. Okay. So before going to comments the presentation, just I would like to ask, what is metabolic syndrome actually? So we know what is metabolism. So metabolism is nothing but it is a biochemical process. So when we take the food, that food particle will be break down into smaller particles and convert into try to conform the energy. So if this process, the metabolic process is disturbed by different parameters, different factors, that is called disorder or syndrome. So collectively it's called as metabolic syndrome. So what happens if metabolic disorder happens? So our heart cannot function properly. The blood cannot receive the proper nutrition. the brain cannot function, the people suffer from cardiovascular diseases, becomes obese. So these are the few complications of the metabolic disorders. So according to the WHO, World Health Organization, the definition of metabolic syndrome is a pathological condition characterized by abdominal obesity, insulin resistance, hypertension, and hyperlipidemia. So this is called as metabolic syndrome. Why the metabolic process disturbs? So what are the parameters? Why it happens? There are two important factors. The first one is the increase in the consumption of high caloric, low fiber fast food, the food habit. So what currently we are consuming, the fast food, that is not provide energy. Instead of providing energy, nutrition for the health, it will disturb our metabolic process and leads to metabolic syndrome. So food habit, first one is food habit. The second important thing is decrease the physical activity, using mechanized transportation and sedentary form of leisure time activities. So from this picture, the bottom picture, we can understand there is a stairs and alongside you can see the escalator. So majority of the people, they prefer to go with the escalator instead of the stairs. So thereby the physical activity is decreased. On the right hand side picture, if you noticed previously, the children used to play in the playground. But currently what they are doing, they are encased with the gadgets. So by the way, the physical activity is reduced, definitely the metabolic process will be changed and finally causes the metabolic syndrome. So here in this presentation, we are going to highlight diabetes mellitus and its causes. As we know, diabetes mellitus, it is a high abnormal blood glucose level. So if the diabetes mellitus not properly controlled, it will lead to severe complications, very dangerous complications. Diabetes mellitus is not a very dangerous one. If you control properly, the patients, they can survive for long duration without any complication. But if not controlled, the blood glucose level not properly monitored and controlled, that leads to various complications. The first one is it will cause the eye problem, that is retinopathy. And leads to second one, it affects the kidney function, that is called as nephropathy. If it causes the nervous system, that will called as neuropathy, and it will cause the strokes, brain stroke, or affect the cardiovascular systems, and finally leads to peripheral vascular diseases or peripheral neuropathy, that will leads to diabetic foot ulcer. So these are the major causes of diabetic mellitus. So here we are going to focus about diabetic foot ulcer. Diabetic foot ulcers among the most common complications of patients who have diabetes mellitus, which is not well controlled. Already I told, diabetes mellitus is not a severe problem, not a serious issue until if you are controlled properly. If otherwise, what happens? That will leads to affect many organs, including diabetic foot ulcer. It is usually the result of poor glycemic control, underlying neuropathy, peripheral vascular disease, and finally poor foot care. So these are the major causes. So what happens if diabetes mellitus is not properly controlled? This diabetes mellitus, it will generate advanced glycation end product in the blood. This advanced glycation end product, it will circulate along with your systemic circulation, and once it reaches to the peripheral area like your foot, there it starts to accumulate it. What is advanced glycation product? It is like considered as a toxic product. It's a waste product. If this AGE is accumulated in your food area, it will not eliminated, it will not excreted from the body. So keep on you are consuming, right, like fast food. So the AGE level inside the body will be increased, and further it causes some complications. First, it will affect the neuropathy, nervous system, and it affects the peripheral vascular diseases. It will block the blood supply to your food area. So the blood supply will be inhibited. So the food cannot get proper nutrition, because if there is no blood supply, the food cannot get enough nutrition. So what happens about cells if they are receive the blood supply? So it starts to die. And if you are not properly take care of our area, then finally the patient suffering with the diabetes. And it is one of the most common cause of osteomyelitis. It's not only affect your food area, so it will migrate to your bones. The infection will migrate to the bones and affect and cause the osteomyelitis as well. If there is infection in the bones, so the patients need to go for amputation to remove the particular area to prevent the infection. So more than 1 in 3 of people with diabetes develop diabetic foot ulcer. If there are 30 number of diabetic patients, out of 30, 10 number of patients are suffering with diabetic foot ulcer during their lifetime. With half of this becoming infected, so means 10 number of patients are suffering diabetic foot ulcer. Out of 10, 5 number of patients are suffering diabetic foot ulcer with the infection. Among these, 15% of patients with diabetic foot ulcer require lower limb amputation to prevent the progression of the infection. So this is the consequence. So must we have to prevent diabetes mellitus? If you suffer diabetes mellitus, the patient need to control properly. If fail to control diabetes mellitus, that will lead to form the diabetic foot ulcer. If not properly take care of the foot area, then it will cause the infection. The infection will migrate to the bone area. If it migrate to bone, then the patient need to go for amputation. This is about diabetic foot ulcer, the consequences. So what about the epidemiology of diabetic foot ulcer? Around 9 to 26 million people are suffering diabetic foot ulcer around the world. That is a huge number, not few thousands. Many millions people are suffering diabetic foot ulcer. As we know, around 15 to 25% of patients with diabetes will develop diabetic foot ulcer during their lifetime. As the number of newly diagnosed patients are increasing yearly, and the incidence of diabetic foot ulcer is also bound to increase. If the number of diabetic cases increased, so likewise, the number of diabetic foot ulcer cases also increased. This diabetic foot ulcer can occur at any age, but are most prevalent in patients with diabetes mellitus age of 45 and above. What about the pathophysiology of diabetic foot ulcer? Already we discussed. So diabetic foot ulcer, first it will start with the diabetes, then followed by the advanced glycation end product accumulation in the peripheral foot area. That will lead to cause peripheral neuropathy. That peripheral neuropathy affects vascular complication at the foot area. It will stop the blood supply. Then it forms the callus in the foot area, means the dead cell formation. Then it starts the wound. The wound, again, it will infected with the different microorganisms. If the microorganisms are migrated to the bone area, then the patient need to go for amputation. These are the pathophysiology of the diabetic foot ulcer. Now we are more focused about diabetic foot infection. Diabetic foot ulcer also we can treat properly. If there is no infection, the treatment is very simple. Easily we can control, we can cure the disease, cure the wound. But if the wound is infected with microorganism, then there will be the challenge for the practitioners or the patients. Diabetic foot ulcer are the devastating microvascular complications of diabetes with an increased prevalence and incidence and high rate of morbidity and mortality. Diabetic foot ulcers and diabetic foot infections are associated with reduced patient quality of life, lower extremity amputation, hospitalization, and high morbidity and mortality. So from this point, we can understand that how it's severe, diabetic foot ulcer and infection. If the patient suffering with diabetes mellitus alone, no issues. They can run their life normally, peacefully, without any difficulties. Like cardiovascular problem or obesity, no problem, it's okay. But the patient suffering with diabetic foot ulcer, it will negatively influence the patient quality of life. How? Because they cannot walk properly. So that the people, they cannot go for work. Even the patient, they who gone for amputation, the mobility of the patient will be inhibited. They need to stay in the hospital for a long time. So if there is no work, there is no wages, no salary for them to survive. They cannot afford to pay the hospital fees. Then it maybe finally leads to increase the mortality. The patients will die after amputation. After a few years, 1 or 2 years, the patients will die. Majority of the cases happen. According to the International Group on the Diabetic Foot, infection in the invasion and multiplication of pathogenic microorganisms within the tissue of the body. Presence and multiplication of microorganisms. That is called diabetic foot infection. Already we know diabetic foot infection leads to increase the mortality rate and finally amputation. It is a severe problem, severe complications. It is estimated that around 50% of diabetic foot ulcers are infected upon presentation, and 80% of non-traumatic lower limb amputations are the consequence of diabetic foot infections. Diabetic foot care is very expensive, with an estimated around $8,700 annual cost per patient, thus emphasizing the importance of early diagnosis and treatment of diabetic foot ulcer or diabetic foot infections. So this is very huge amount. They need to invest. If the patients suffering with the diabetic foot ulcer, already mentioned, they cannot go for work, then how they can afford to pay this much amount of hospitalization fees? That's why the patients need to go for proper early diagnosis to prevent diabetic foot ulcer or at least prevent the infection formation. The treatment consists of improving patient intrinsic factor, such as improving blood glucose level, as well as targeting extrinsic factors, such as principle being removal of bacterial contamination from the wound site. So by these two ways, we can able to control the cases, complications. First one is to control our blood glucose level within the optimum range by using anti-diabetic medications. Second one, we need to remove the infection, remove the pathogenic microorganism from the wound area. So by these two ways, we can able to control the diabetic foot infection severity. However, diabetic foot ulcer harbor diverse bacterial communities, which increase the difficulty in the treatment of choice. But however, still we need to face the challenge to treat the diabetic foot infection because it involved with numerous bacterial colonies. very difficult to treat the infection. If one or two specific microorganisms involved for this infection, then easily we can treat with our medications. But here, diabetic foot infection is involved with the diverse bacterial communities. That's why the treatment is highly challenging one. Then prevalence and incidence of diabetic foot ulcer. Increasing case of diabetes mellitus, especially type 2 diabetes, have raised public health concern in global scale. Globally, there were 425 million persons with diabetes mellitus in 2017 year. And by 2045, the number is expected to rise to around 629 million. There will be huge growth in terms of diabetes mellitus. It is considered the major economic burden for all countries, but developing countries suffer the worst of it because they account more than 80% of all cases. Incidence of diabetic foot ulcer is mostly observed in patients having extended history of diabetes, and the prevalence rate is between 5.3% to 10.5%. So what are the microorganisms? Because diabetic foot infection involved with diverse range of microorganisms, not one or two. There are plenty of microorganisms. In contrast, chronic diabetic foot infections may have polymicrobial infections colonizing by different types of aerobic bacteria such as Staphylococcus, Streptococcus, Enterococcus, Pseudomonas, anaerobic pathogens. So these are the bacteria, microorganisms are available in that foot area. Apart from that, bacterioids flagell have also been reported in several studies as the most abundant anaerobic bacteria in diabetic foot infection. So this is a graph representing what are the microorganisms are isolated from the diabetic foot infections. So from this picture, we can understand that the Streptococcus is accounted for more than 500 number of cases, then followed by Staphylococcus and maybe the Enterococcus, some other Klebsiella and other microorganisms. So Staphylococcus is a major microorganism which involved for the diabetic foot infection. Next one is polymicrobial infection. Diabetic foot infections are composed of mixture of bacteria. Consequently, the production of many different virulence factors such as proteases, collagenases, and hemolysins. Not only microorganisms. Apart from the microorganism, there are some virulence factors like some enzymes, like protease enzymes, collagenase enzymes, hemolysins. So these are the enzymes also which will cause the polymicrobial infection in the diabetic foot. These polymicrobial infections were estimated to occur in 75% of diabetic infection cases. Next, further complication is biofilm. So once wound is infected with microorganism, then it will go for polymicrobial contamination. After polymicrobial infection occurs in the wound area, then it starts to develop biofilms. What is biofilm? Biofilms are complex protective matrix composed of bacterial colonies and various extracellular polymeric substance, sugars, lipids, and glycocalyx, impacting ecophysical and immunological protective and adhesive abilities. So here we must understand the difference between infection, polymicrobial infection, and biofilms. Infection means the wound is infected with one or two microorganisms, that is infection. The second case, polymicrobial infection, means it involved with complex or mixture of microorganisms, that is polymicrobial, along with that some enzymes. Then final stage, the polymicrobial infection will lead to biofilms. It is made up of various extracellular components, sugars, lipids, and these are the materials are responsible for the biofilm production. So what happens if the wound is developed with biofilms? Biofilms allow the bioburden to flourish, which in turn allow the biofilm to further stabilize, adhere, and progress. So make it simple. This biofilm, it will cover the wound, protective layer of the wound. Means if you apply any drug, any ointment, or antibacterial agent, it cannot diffuse through this biofilm to reach your own area. So our medications fail to cure the disease. That is a major complication of this biofilm. So it protect against the medications. Biofilm also contributes to persistence of chronic inflammation. So this will lead to chronic wound. If there is no biofilm, easily we can apply our topical medications to treat the wounds. If the wound is protected with biofilm, our medications cannot able to penetrate through this biofilm and inhibit the healing process, leads to chronic inflammation. This will facilitate the horizontal transfer of antimicrobial resistance. Fine. So these are the complexizations. Then how to treat these diabetic foot infections? While antibiotic treatment for diabetic foot infection is initially prescribed empirically, accurate bacterial identification of diabetic foot infection can improve therapeutic approach. Basically, we used to treat the infection with random antibiotic therapy. Actually, we have to identify which microorganism is present in the particular wound site. We need to diagnose properly. According to the presence of bacteria, we have to choose the proper antibiotic therapy. But we fail to do this process. The selection of most effective antibiotic is a vital step to reduce the treatment period. If you select proper antibiotic, easily we can heal the wound and prevent the expansion of resistant bacterial strains and limit the healthcare cost. If we fail to diagnose properly, identify the microorganisms, then the microbes will becomes methicillin-resistant Staphylococcus aureus, MRSA. This is a common bacterial pathogens in diabetic infection and difficult to treat the infection. Compared to non-MRSA infection, diabetic people with MRSA infection have greater than 5-fold increase in mortality. Who are suffering or face to this mortality case? The patient, those who have MRSA microorganisms. Non-MRSA easily we can treat with antibiotic therapy. So that's why we have to identify, we have to diagnose this properly, right? We have to take the sample and analyze which microorganism exactly present in the wound site. Accordingly, we have to choose proper topical antibiotic or oral antibiotics. The susceptibility pattern of Staphylococcus species and gram-negative bacteria should regularly be monitored in diabetic foot infections. Because these are the microorganisms causes leads to MRSA. Other microorganisms we can analyze periodically, means every 6 months or every year we can monitor. No issues. However, we have to focus these two microorganisms, either Staphylococcus and gram-negative bacteria. These are the more dangerous, deadly microorganisms. Wounds have been classified based on the Infectious Disease Society of America system, right? So we have 4 different kinds of treatment. So first one, we have started with non-infected wounds. In there is a wound, but we have diagnosed with there is no microorganism. That is called non-infected wounds. To prevent possible infection, and improve the wound healing process, different classes of antibiotics are being prescribed by clinicians, even for non-infected wounds. The category mentioned non-infected wounds. The infection, there is no microorganism, no pathogens. Then why we need to dispense antibiotic? Because they want to speed up the healing process. But actually, you should not prescribe. We should not prescribe, we should not administer any topical or any oral antibiotics for these cases. There is, however, no consensus to support this practice, which may also increase the treatment-related adverse event instead of healing. So it will cause some adverse effect. Or the microorganism may be form the resistant, develop to resist your antibiotics later stage. The European World Management Association has prohibited antibiotic prescription for uninfected wounds. For this case, we should not go with any antibiotic therapy. Fine. Second one, mild infection. If the patients are diagnosed with mild infections. Mild infections are characterized by inflamed subcutaneous tissue, which may vary in size, but are found less than 2 centimeters from the surrounding of the ulcer, from the border of the ulcer. That is categorized as a mild infection. For this case, gram-positive cocci or Staphylococcus aureus and group B streptococci have been frequently isolated in the mild stage. Hence, antibiotic that target gram-positive bacteria may be a good choice for this stage of infection. So here we have to recommend the antibiotic therapy. For mild infection can be healed using oral antibiotics. Example, quinolones, trimethoprim, sulfamethoxazole, clindamycins. So these are the drugs, antibiotics are recommended for mild infection cases. Based on the IDSA guideline, mild infection require shorter course of antibiotic treatment compared to moderate and severe infection. So what is the duration of this particular case? Up to 2 weeks. Antibiotic therapy must be within 2 weeks period. We should not extend more than 2 weeks if the case is present with the mild infections. Third one is moderate to severe infection. Here, heterogeneous mixture of aerobic gram-positive cocci, aerobic gram-negative bacilli, and anaerobic pathogens can be isolated from the moderate to severe stage of infections. Based on the IDSA guideline, moderate to severe infection need to up to 4 weeks of antibiotic therapy. The previous case, just we need 2 weeks therapy. For moderate to severe infection, we need 4 weeks therapy. Narrow spectrum oral antibiotic and broad spectrum parenteral antibiotics are administered for mild to severe infections respectively. In either case, the presence of Staphylococcus and Streptococcus species should always consider. Example, cotrimoxazole, tetracyclines, rifampicin, linezolid, fluoroquinolones, and clindamycins. So these are the drugs are recommended for the treatment of diabetic foot infection with moderate to severe cases. Fourth one is natural antimicrobial peptides. Due to high incidence of multi-drug resistance bacterial strains, traditional antibiotics have become less effective against broad range of bacteria. So what are the bacteria antibiotics? We have discussed previous slides that won't work if the wound have a multi-drug resistance by pathogens like MRSA. Those cases need highly novel, powerful medicament or agent to kill that MRSA. That is nothing but these peptides, natural antimicrobial peptides, or otherwise called as host defense peptides, which are derived from host innate immune responses, have broad spectrum activity against gram-positive as well as gram-negative pathogens. According to the previous report, antimicrobial proteins isolated from the small intestine of the rabbits were found to display antimicrobial activity against Staphylococcus aureus, Pseudomonas aeruginosa, E. coli, and Candida albicans. This is more powerful antimicrobial agents to treat the MRSA. Next one is bacteriophages. Same like the antimicrobial peptides, bacteriophage is also one of the novel compound, the recent compound. It's also more powerful against polymicrobial infection or to treat the biofilms or to treat the MRSA pathogens. When conventional antibiotic therapies are less useful for MRSA infections, we have to find out the new novel techniques or antibiotics. This bacteriophage therapy is a novel and potential alternative therapy to overcome MRSA infections. It is recommended to combine the bacteriophage and antibiotic therapy to increase the efficiency of MRSA treatment. Either we can use bacteriophage alone to treat the MRSA, or some cases we can combine this bacteriophage along with our traditional antibiotic therapy to get more efficacious wound healing process. Due to complexity of bacterial community colonized in DFI, the mixture of phages may require to target wide range of bacterial population. Anti-Staphylococcus phages have the broad range of activity, hence 2 or 3 different phages are required to target different strains of Staphylococcus aureus. When the wound present with gram-negative bacteria, those cases we need to administer with more than 10 number of bacteriophages. So this is the difference. So according to the presence of bacteria, either Staphylococcus aureus, just we need 2 or 3 bacteriophages. If the wound is infected with gram-negative bacteria, those cases we need to go with more than 10 number of bacteriophages. Okay, fine. So we have where we need to use antibiotic, where should not use antibiotics. Yes, infected wound, we need antibiotics. Non-infected wound, we came to know that no need, right? So we have the traditional antibiotic therapy, either topical antibiotics or oral or parenteral antibiotic therapies are existing in the market. So according to the severity of the cases, we have to choose proper antibiotics. If like a MRSA, whether we need to go for antimicrobial peptides or bacteriophages, right? We have plenty of options to treat these infections. But still, the clinicians or the physician, they are facing challenge to treat these diabetic foot infections. So what are the reasons? What are the factors? Mainly resistant strains. Why resistant strains? If you are not properly administered proper antibiotic for proper pathogen, then that microorganism leads to resistance to the particular antibiotics. Next one is polymicrobial infections. The infection is combined with numerous number of pathogens, then that will be very challenging for us to treat. Next one is appropriate tissue or pus sampling. So if the tissues are properly identified or not exposed while applying your medicament, that will be difficult to heal it. Next one is antibiotic stewardship and misuse. Misuse means if you administer the antibiotic for non-infected wound, that is a misuse of your antibiotics. Then finally, that microorganism becomes a resistant strains. Final one is unpredictable recurrence. There will be the huge chance of recurrence. So these are the challenges in the management of diabetic foot ulcer. So this will cause adverse effect of topical antimicrobials are also concerning very important parameter, and duration of antibiotics, because it is a chronic therapy required for to treat the chronic diabetic wound. So if you are administered for long duration of therapy, right? So we don't know how long we need to dispense or need to administer this particular antibiotics. So already we mentioned for mild infection, we need to administer antibiotic only for 2 weeks. For severe to moderate, only 4 weeks. But within 4 weeks, the wound cannot be healed in some cases. Then how to heal this, how to treat this infection? That will be the challenge for us. Next one is cost factor. If you want to treat for long duration, including your oral, antibiotic, topical, and parenteral, definitely the cost of therapy will be very huge. That will affect the socio-economic burden for the patient as well as the country. The prolonged use of such medications might result in the microorganism developing antibiotic resistance, a critical issue that exists in the present day. Although numerous topical and systemic agents have been used either individually or in combination to eradicate infections, many have been eliminated because of resistance. These agents have led to emergence of subsequent rapid overgrowth of resistant bacterial strains, drug side effects, and organ-specific toxicity, ultimately leading to increased cost, morbidity, and mortality rate. With an increasing frequency of antibiotic-resistant pathogens, modern medicines direct attention to natural products with antimicrobial activity for clinical practice. That's why we are keen to identify, to explore the medicines from natural source, from herbal source to treat this diabetic foot infection or diabetic ulcer, because the conventional traditional antibiotics are failed to treat the polymicrobial infections or to pass through these biofilms. So why we are focused to develop the medicines from the herbal sources? As we know, it is people, they think that if you treat the disease or infection with a herbal product, herbal medicines, they feel that it will cure permanently. And second one is safe. But basically, herbal products are safe, but not always. Some herbal medicines are produce toxic effect. We must be aware of that. And eco-friendly, yes, this is a natural source. Definitely, it is eco-friendly and cheap. Not all the herbal medicines are cheap. Some herbal nutritions are selling in the market with a high price, but basically it is cheap. Herbal medicines are very economical and no adverse effect. So for these cases, for these advantages, we are focused to develop medicines from the herbal sources or natural sources for the treatment of diabetic foot infections. What about the scenario herbal medicines in Indonesia? Medicinal plants play essential role in primary health care practice in Indonesia, particularly in rural areas. Not only Indonesia, if you go to any country, the rural peoples, they are use this natural medicine, herbal medicine to cure their disease or disorders. Traditionally, they are using. While medicinal plants are broadly used in Indonesia, the country has made commitment to healthcare service based on the modern medicine through the provisions of universal health coverage. Since long time ago, the properties of Indonesian herbal medicine have been widely known to help health and increase the endurance. So we are not used recently. From ancient days, we are used these herbal medicines to treat the diseases. The potential of medicinal plants, which are widely grown in various parts of Indonesia, is very prospective to be developed because of the potential need around the world. There is a huge market. There is a huge demand around the world. The herbal medicine which is grown in the Indonesia have a huge market. So you have to aware of that. So you have to utilize that. So we have to identify which herbal ingredient is have a huge international market. It is recorded that export destination countries for Indonesia herbal medicines include Australia, Saudi Arabia, China, and United States. Although herbal medicines are popular all across Asia, with companies from China and Malaysia as the current market leaders, And also Indonesia that has the biggest and fastest growing traditional medicines business in the region, ASEAN region. According to the report of Euromonitor International, by 2017, the turnover of expected to reach around $800 million per year. So by this figure, we can understand what is the market potential for these herbal medicines around the world. Do you know how many number of medicinal plants available in Indonesia? Around 30,000 species. Around 30,000 herbal species are available in rainforest all across Indonesia. But out of 30,000, only 1,000 species have been recognized till now, identified till now to treat some of the diseases. But still, there are 29,000 species are unexplored, which is available in Indonesia. We must aware of that. So that's why we have to focus to develop herbal medicines to treat the metabolic syndromes, not only for diabetic foot infection. So we can use to develop some other cases as well. So from this numerics, from this graph, we can understand that what is the market potential, what is the importance of these herbal medicines. So what is the growth rate of these herbal medicines, the market? From 2022 to 2026, the growth rate is expected that 6.69%. There is a huge percentage of growth rate. So what about the contribution in terms of Asia? How much percentage of contributed the international demand for the herbal medicines? The Asian country, they are contributed more than 42% for the whole world. So Indonesia also one of the country to contribute for the demand, international demand. Okay, fine. Who are the companies, top players are involved in the development of herbal medicines around the world? So this is a list of companies. Few companies are listed here. One is Arizona Natural Products, Arco Pharma Laboratories, Biobotanica, Blackmores, Dabur India, Himalaya Global Holdings, Hishimo, Ricola, Chapter, Zen Pharma. These are the known pharmaceutical company. They are developing or they are exporting the natural product around the world. So now we are more focused to medicinal plants for diabetic foot ulcer and infections. Numerous plant and herbal species with wound healing properties under diabetic state have been discovered as a result of ethnobotanical research in Africa or Asian continent and other developing countries. Based on the evidence, many researchers have scientifically validated the use of using various experimental models. We are not using this medicinal plant to treat this diabetic foot ulcer current days. We are using these medicines from ancient days to treat different ailments. But currently, we are starting to develop evidence-based research, evidence-based product to treat the particular diseases. Few medicinal plants that possess remarkable diabetic foot ulcer healing activity, including Ageratina, aloe vera. Aloe vera is one of the most popular herbal material, right? Easily available in the world to treat for different cases, different diseases, including diabetic foot ulcer. Next one is Actinidia, Aristolochia, Azardica, Coffee, Melilotus. So these are the popular medicines for the treatment of diabetic foot ulcer. Despite the limited information available in the natural substance used for the management of diabetic foot ulcer, some medicinal plants with promising preclinical and clinical effects reported. Already told, many plants are available for the treatment, but only few herbals are tested with the preclinical and clinical investigations. That is including Ageritina, aloe vera, astragalus, azardica, coffee, melilotus, mitus, onosma, corcus, tecurium, chinospora. So these are the few herbal medicines are investigated with the preclinical and clinical studies. In India, the concept of polyherbal formulation has been highlighted in Ayurvedic literature, Sangha Shamhita, since year 1300 AD. So they focused to develop the product with the polyherbals, not single herbal to treat the particular disease. They used to manufacture, they used to compound with different herbals. It is mainly based upon combining several medicinal herbs to achieve better therapeutic effect. The purpose is to get better therapeutic effect. If you need to go with single herb, so we need to use higher concentration of the particular ingredient. If you use higher concentration of single herb for one product, that will cause some side effects. That's why they combine different polyherbs to develop particular medicines. Similarly, it requires low dose to achieve desirable pharmacological activity, which ultimately reduce the risk of deleterious side effects in human. That's the philosophy why they follow this polyherbal formulation. Many other traditional practice, not only Ayurveda. Apart from Ayurveda, there are traditional Chinese medicine, traditional European medicine, traditional Korean medicine, traditional African medicines. They are also used to develop with the polyherbal formulation concept in order to get better therapeutic effect, and at the same time try to reduce the side effect or deleterious effect by using single herb. And it is well established that traditional Chinese herbal medicine is widely practiced and is a substitute for traditional medicine under severe conditions. Example, Radix astragalli and Radix Rehmannia are described as promoter for proliferation of fibroblast and the central step in wound healing process. So they combine the two different herbals, Radix astragalli and Radix Rehmannia. So what is the mechanism of action of this Radix astragallia and Rehmannia? Astragallia strengthens the functioning of the chi, which refers to wound healing. It takes care of the wound healing process. The first herbal, astragalli. The second one, Rehmannia, consists of reducing the heat in the blood and nourishing the yin and enhancing the production of body fluids so that the immunity will be strengthened in that particular infected area. So one herb used to take care of the healing process, another herb used to purify the blood so that the immune function will be normalized so that easily it can kill the microorganism. So finally, the wound healing process will be fastened. Jiko is the traditional herbal medicine for wound healing that was used for several hundred years in China. But the recent year, the Zheng, the researcher, revealed that arnabine 1 and naphthoquinone derivative plays the most significant role in the wound healing properties in the plant. So from this, we can understand that traditionally they use crude extract for the treatment of the wound infection. But recent days, the scientists, they isolate or they fractionate the active constituent from the particular extract and use to treat the infection. These are one of the examples from the Jiko extract. Next one is very popular ingredient. We know very commonly used for our culinary purpose. That is a lime, grapefruit, and orange. So here for diabetic foot ulcer, the oral dose of extract of citrus peel in diabetic rats were evaluated and examined if these extracts could be beneficial in the regeneration of ulcer. The authors obtained positive outcomes in the reduction of glucose in the blood and wound healing rate and introduced this therapy as a potential therapeutic alternative for the treatment of diabetic foot ulcer. So means the waste product, what you feel, that orange peel, the lemon peel, grapefruit peel, we are discarding after eating the fruit, or you take the juice, just we are discarding the peel. But the peel extract have the potential to treat the diabetic foot infection and able to control the blood glucose level as well. So apart from that, other herbs like hypericum and the combination with asafoetida. Asafoetida, one of the most popular traditional herbs, that is nothing but it is a neem leaf used for treating various infections, including diabetic foot ulcer. So for this case, the scientists, they combine these two herbs together to treat the infection. So they noticed that the granulated tissues are increased tremendously after treating these two extracts. The remodeling of the skin tissue also will be proliferated, means increased exponentially. A year later, the same group conducted another study using the same combination of this extract, that is called as hyper oil, to evaluate the improvement in the glycemic control and peripheral microvascular complications in the neuropathic patients with advanced diabetic foot ulcer, with positive results happen. So another popular ingredient, that is nothing but murmurica, like a bitter gourd. It is one of the most popular remedies. Right, with the ointment base, the extract is combined with the ointment base as evaluated for the healing of acceleration of diabetic wound in diabetic male steroids. So the results revealed that have the potential, have the healing property by increasing the transforming expression like a tumor growth factor. Our next study in Thailand, the effectiveness of food bathing with the Thai herbs to treat the food complication in diabetic patients reported, and most patients had improved food sensation and the lower risk of pedicel insertion following the treatment. In their study, they revealed that potential role of polyherbal formulation, which consists of 7 different herbal Thai herbs extract and were developed based on the traditional Thai practice, used as alternative treatment for diabetic foot ulcer. The herbal formulation were exhibited the most potent ability to promote diabetic foot repair and suppress pathogenic bacterial infection of the skin. So this study provides evidence supporting the efficacy of polyherbal formulations containing like a curcumin, like a turmeric, like a ginger, like asafoetida, like a pepper or catechol. These are the active ingredients they have used to develop this polyherbal formulation. So another important herbal formulation is Xing Wang Hun ointment. This ointment comprises of 30 different Chinese herbs that are intended to stimulate blood circulation in order to disperse the blood stasis. As we know, why the diabetic foot ulcer is causes, because a lack of blood supply in the foot area. These herbs, this ointment used to promote the blood supply to the peripheral foot area. So out of 30 varieties of Chinese herbs, these are the important prominent herbs are included. One is Angelica, Oriole, Pangoli, Radix, Rhizoma, Red Peony root, and Rhizoma. These are the important herbs included in this particular ointment. They tested with these rats to treat the diabetic foot ulcer. So from this study, they revealed that the wound closure rate is very faster. So within 21 days, the wound is completely healed. So by the way, we can conclude that these herbs are most effective to treat the wound diabetic infection. Another popular ingredient is benzoyl HP product. Benzoyl HP is a topical ointment used to treat ulcer and wounds in the area. So this product consisted with the salicylic acid, benzoic acid, and polyethylene glycol with the herbal extract that is nothing but Corcus rhubarb bark extract. So this formulation basically used to develop to treat the eczema conditions, right? After noticing the prominent efficacy of this particular product, other researchers like Jacobs et al., they have used to treat diabetic foot ulcer and compare the efficacy against silver sulfadizine cream. They noticed that this benzol HP ointment have better healing rate with the rate of 72% as compared with 54% of shrink rate with the silver sulfadizine cream. So another important product is semilil. It's a natural herbal extract of the Melilotus species that have been proposed for the treatment of diabetic foot ulcer. So this activity is primarily driven by coumarins and flavonoids. These are the active phytoconstituents present in this particular plant extract. So this product also tested with the patients, clinical trials, around 25 patients. They make in the two different groups. One group used to get conventional therapy. Another treatment group used to get this SMLL product. So after 4 weeks of therapy, they noticed that 64% of healing efficacy as compared with 25% against with this conventional therapy. So we concluded that this particular compound, like a coumarins, have the efficacy to heal the wound. So another researcher like Viswanathan in 2011, they reported that the polyherbal formulation cream on diabetic foot ulcer tested on 40 number of diabetic patients. So the group 1 used to get the polyherbal formulation. The group 2, they received the sulfadizine standard treatment. So all the patients were monitored up to 5 months period. So after the period, they noticed that there was a significant difference in the size of wound in both the study groups. The mean time taken for the healing of the ulcer was around 43 days in both groups. Next one is kiwi fruit, one of the most popular fruit extract used for the treatment of diabetic foot ulcer. So here, some researcher, they tested this kiwi fruit extract against the standard treatment therapy. That includes surgical debridement, and they used ciprofloxacin as an antibiotic 500 mg twice daily, clindamycin 600 milligram thrice daily, and compare the efficacy against this kiwi fruit extract. After 21 days of treatment, the intervention group showed significant difference in both ulcer size and time to wound closure compared with the control group. Not only healing rate, right? Additionally, there was significant improvement in the vascularization and granulation and collagen formation and inflammation at the wound site. So now from these slides, we concluded that from ancient days to till date, there are numerous herbals, either single herbs or polyherbs, are used to develop with their traditional practice, either Indian medicine or Chinese or Korea or African practice to treat the diabetic foot ulcer. So later case, they have developed some preclinical investigation and clinical investigation to prove that efficacy against this diabetic foot ulcer. So now we move on to next category, that is herbal nanomedicine for diabetic foot ulcer. So why need to propose this nanomedicine for herbal product to treat the diabetic foot ulcer? Previously, we know that our herbal extract have the efficiency to heal the wound, to kill the microorganisms, to improve the collagen synthesis, to proliferate the fibroblast cells, everything. But however, our extract, our traditional ointment or traditional creams cannot able to penetrate into the biofilms. We know the complication of biofilms, the polymicrobial infections. So it means our compound must need to pass through the biofilms. So traditional conventional product cannot able to diffuse through the biofilms. That's why we need some carrier so that it can easily diffuse through the biofilm to kill the infection which is located in the wound site. So what is nanomedicine? Nanomedicine is nothing but it is a size matter. The size of the product, the size of the extract, the compound is in the form of nanometer scale. Millimeter, micrometer, then finally nanometer scale, very minute. So we have to develop the product into the nanometer scale so that our compound have the efficiency to pass through effectively and heal the wound. So the presence of biofilms leads to prolonged inflammation by stimulation of nitric oxide, cytokine, and free radicals. Hence, an effective treatment is required to deliver antimicrobial drugs to infected wounds for normal wound healing. In this regard, nanoparticles can be utilized to specifically target and eliminate the pathogens. So the antimicrobial effect of nanoparticles comprise of destruction of cell membrane, means have the ability to break down the biofilms, and impediment the enzyme pathways, able to inhibit some specific enzymes, which is causes the diabetic foot ulcer, and modification of microbial cell wall and nucleic materials pathways as well as delivery systems. So with these remarkable advantages of nanomedicines, we are going to develop some of the research that they developed already with the product, the herbal extract for the treatment of diabetic foot ulcer. The first example is silver nanoparticles embedded in the cellulose nanocrystals isolated from Syzygium cumini leaves extract for the treatment of wound healing. And another researcher, they developed PLGA nanoparticles encapsulated with ferulic acid to study the effect in diabetic wound healing. This ferulic acid is a phenolic compound and natural antioxidant with a potential synergistic therapeutic effect in diabetic wound healing due to its hypoglycemic, free radical scavenging property, angiogenic, antibacterial, and neurogenic effect. Next one is the formation of advanced glycation product. Already we mentioned this is a major culprit for the development of diabetic foot ulcer, that is advanced glycation product. It is highly available in the fast food or maybe in the BBQ chicken. If you notice, there is a black color spot in the BBQ chicken. That is nothing but is will cause the advanced glycation product. So this is a very important component, need to be inhibited or we need to eliminate from the body. So for this case, so some research like Chen et al., they demonstrated that combination of antioxidant like epigallocatechin gallate, it is the main phytoconstituent which is present in the green tea extract, and alpha lipoic acid encapsulated into the nanoparticle in the specific concentration significantly decreased the expression of the particular receptor of the AGE protein within cultured fibroblast and diabetic wound healing in the mouse model. So this is advancement of herbal nanomedicine. Means traditionally they use the extract, the crude extract to treat the diabetic foot ulcer. But here they isolate the main active constituent from the green tea extract, that is epigallocatechin, EGCG. Right? So first isolate the compound, then this isolated compound must be loaded into the nanoparticles so that our compound easily break down the biofilms and easily can go inside and kill the pathogenic microorganisms. So now we move on to the final stage of the presentation, that is diabetic foot ulcer market. The Southeast Asia advanced wound care market size was valued around 220 million US dollars in 2022 and is expected to expand at the compound annual growth rate of 6% from 2023 to 2030. The rising prevalence of chronic diseases, mainly diabetes and obesity, is one of the key factors leading to an increase in the incidence of chronic wounds such as diabetic foot ulcer, venous leg ulcer, and pressure ulcers. For instance, as per data published by the government of Singapore, as of December 2021, the study showed that diabetes contributed to 87% of arterial insufficiency ulcer in the population of Singapore. This is a graphical representation of Singapore market. In 2020, the market size is around 27 million Singapore dollars. So if the year is increasing from 2020 to 21, 23, means gradually the market size also increasing proportionally. The antimicrobial wound care segment is projected to witness the fastest CAGR of 6.6 over the forecast period. The segment is majorly indicated for partial and full thickness wound, such as surgical incision and percutaneous line sites. These products are available as a nylon fabric, flame care, sponges, impregnated wound gauze, or combination of different materials like maybe gels, maybe creams, or ointment, or something else. So there are major factors contributing to market growth, including increasing incidence of ulcers, such as arterial ulcers or diabetic foot ulcers. Similarly, according to ID Diabetes Atlas, Indonesia ranked 5th in the 2019 with around 7.9 million adults aged between 20 to 79 having undiagnosed diabetes. Healing of this chronic wound requires advanced wound care product, thus impelling the growth of market over the forecast period. If we want to tap this opportunity, means we need to identify the potential phytoconstituent from the herbal sources. At the same time, the compound must be utilized with the nanomedicine concept so that the efficacy of the medicines will be higher for the treatment of diabetic foot infections. With this, we are going to conclude the following points. Although the plant extract employed in clinical studies have significant advantages, the specific mechanism of action at the biochemical and molecular levels has been researched, indicating the research gap. Relatively little research had been conducted on isolated and purified chemicals from the natural source. I already mentioned about the phytoconstituent from the green tea extract, that is Apigelia catechii. So currently, the scientists, the manufacturer, they are trying to isolate the potential phytoconstituent from the extract and develop the evidence. Scientists to investigate more on the active phytoconstituents and to come up with a novel molecule for the treatment of diabetic foot ulcer. So hereafter, the crude extract will not be beneficial for the treatment of diabetic ulcer. So we need isolated or particular phytoconstituents. Even though few polyherbal formulations were documented previously, there are relatively few marketed treatments available for the alternative medicine in the treatment of diabetic ulcer. Extensive clinical trials on DFU are required for current scenario, taking into account that therapeutic properties of plant, animal source, or insect and diuretic compounds. And conclude that natural therapy can be explored further to treat and manage diabetic foot ulcer in an efficient, cost-effective, and reproducible manner. However, further development will require more concrete action, such as establishment of different programs. We need to generate the students or the researcher from the different streams to produce scientifically minded expert in the field, so that we can able to establish many products from the herbal sources. If done properly, this will help enable Indonesia's herbal medicine industry to produce better products and benefit more people. With this, I express my gratitude for your time, valuable time. Okay. And I express my sincere thanks to all the organizing committee for giving this great opportunity to express my views about metabolic syndrome, especially for treatment of diabetic foot infections. Thank you once again.
Thank you, Professor Satheesh. That was an interesting and comprehensive presentation, Professor. Once again, thank you. And from your presentation, we all know that diabetes is still one of the highlighted diseases in all around the world, and not only diabetes itself, but also the complication it causes, and diabetic foot ulcer is one of those. And from your presentation, we know that this complication is still challenging to treat, and we need more research in that. Okay, and ladies and gentlemen, now we've come to the Q&A or discussion session, and we are glad. Maybe is there any audience who wants to ask a question? Okay, Miss Gihad, our MCs today, would like to ask some question, please, Miss Gihad.
Yes, thank you so much, Ms. Vidya, for the opportunity. Is my voice clear?
Yes, please.
Okay. Thank you. Thank you so much, Professor, for the very interesting presentation. I have two questions. First question, we saw that there were a lot of herbal medicine that would treat the FEU, and as stated before, that it would be as a permanent cure, and mostly from the medicines that you stated, they have healing properties. So I would like to ask, where else does it stand? Can it be as a curative, a preventive measure, or could it be also taken like rehabilitative measure or a palliative measure? And my second question is, so from your earlier presentation, you stated that DFU could be caused by different types of pathogens or bacteria. And in modern science, in modern antibiotics, we have like different spectrums for specific infection diseases. For instance, like this bacteria gets this antibiotic and so on. So where does that stand in herbal medicine? Thank you. I hope my question is clear.
Thank you, Ms. Gihad. Professor Satheesh, you can answer the question.
So, the first question is related to preventive therapy, right, with the herbal medicines. Am I correct?
Yes.
Yes, actually the herbs, what they already used like neem oil, maybe aloe vera, right? So the aloe vera, for example, we can use to treat the wound. If the patient have the wound, if you apply this aloe vera gel or extract, it will kill the microorganism, and same time it will produce more amount of collagen. It will increase the secretion of more fibroblast. It will generate more vascular in that particular wound site. Means particular extract have the multiple application. So according to the condition of wound, either mild wound or moderate or severe, it will work accordingly. That is herbal extract. But if the wound have biofilms like polymicrobial infection, so the normal crude extract could not able to function properly. It will be inhibited by the biofilms. So those cases, this material, the phytoconstituent, must be put into some medicine like nanomaterials. So the nanomaterials have the capability to easily penetrate through that biofilms and release the active ingredient at that site to function like normally. So means not only kill the microorganisms, if the wound wants to heal it, so the product must be taken of multiple aspects, not only kill the infections. So there will be the more collagen, there will need more fibroblasts, there will be need more migrations, there will be more blood supply required, right? So everything need to take care of these particular medicines according to the conditions, right? Okay, the same aloe vera gel if you apply for diabetic patient in the food area, means their patient, they don't have wound, but they are aware to prevent the wound formation in future cases, future days, means they can apply some compounds like essential oil or some other herbal compound easily available. Just apply on the skin, the foot peripheral area, do little bit massage on the particular, so that the blood supply will be normalized. If there is a proper blood supply to the peripheral area, so it will not cause any diabetes, food ulcer, right? This is preventive. Means the same herbal compound have the capability to generate or to improve the blood supply or to develop new vascular in the particular peripheral area. So we can use as a preventive therapy, or if the patient have the infection or have the wound, we can apply this product to heal the wound. Either one for preventive, another one is for healing process. Both the cases, the herbal medicines are work accordingly. And next question, doctor.
The next question was about, so in your earlier presentation, it states that DFU are caused by multiple
Infection.
infection.
Okay.
Yeah.
What stage we have to apply for diabetic food? This herbal medicine, right? Yes. Same question. If the same answer is applicable for case 2 also, the question 2 also, because if there is no infection, if you apply aloe vera gel, it starts to promote the normal wound healing. If you apply aloe vera gel into infected wound, it acts as an antimicrobial agent. So if you apply this aloe vera gel into severe cases, means it will generate or it will produce more fibroblast cells. It will provide more keratinocytes, so that not only to kill the bacteria, so along with that, there will be more cellular production, so that it will be healed normally. So it behaves, right? So from non-infected wounds to until the more complex polymicrobial infections. But polymicrobial infection, some cases we need to go with traditional antibiotic along with that our herbal medicines. So case to case, the treatment option will be vary.
Okay, thank you so much. So it all depends on the severity of the wound, right?
Yeah, everything depends upon the case and depends on the severity of the cases. Either there is microorganism or there is a lack of cellular production. So accordingly.
Okay. Thank you so much for the answer.
Thank you, Doctor.
Thank you, Ms. Gihad and Professor Satheesh for the answer. And the next question is come from Dr. Denny Iskandar. He's one of our lecturers. Mr. Denny is asking, I would like to have your view on herbal medicine development in Malaysia in terms of bench to bedside in a clinical setting. What is it like and what major challenges faced?
Actually, to bring the herbal product to the bedside, very easy. So why our faculty, our Lincoln have opted to this one? There is a challenge for the treatment of diabetic foot ulcer. At the same time, the medication, the development of medication is very easy because it is not comes under medicines. This is comes under in Malaysia. This comes under medical device. So easily, if we can able to provide preclinical and clinical data, easily the product can be marketed. Easily, it will be reached to the market. So if you want to develop medicines, we need to spend long years, around 10 years, to bring the product to the bedside. For the case of diabetic foot ulcer, since it is a topical product, just we need to identify the compound, do the proper formulation, then we can establish clinical and preclinical investigations. So everything maximum 3 to 4 years, we can generate all the data. With the data, if you go for product registration, then it will be very simple, easy.
So it's pretty simple in to bring the product to the market for this case, right?
Exactly, Prof.
Okay. Maybe in the future, Mr. Daniel wants to do a collaboration with you, Professor Satheesh.
Thank you, Prof. Welcome. Yeah, we are also willing to collaborate.
Okay, and it's two more questions maybe from
Yes, ma'am.
our students, Habib Nur Abdul. I read in some literature that this metabolic syndrome disease, the prevalence in the world is still relatively large. How can we overcome it? How effective can herbal medicine overcome metabolic syndrome disease? Please, Professor.
This one, yeah, we are aware that in 2030, the 2045, the number is going to double up. So if double, so what we are going to do as a student, as a young people, we must be take care of our health. So how to take care? So we need to increase the physical activity. So in the very beginning slide, we already mentioned. So due to physical activity, due to our food intake, leads to develop different metabolic disorders, including diabetes, CVD, etc. So one is prevention. No need to focus for herbal, right? So if you consume herbal nowadays, then we can able to prevent. So what herbals? We can include curcumin, we can include neem leaf, include moringa leaf. So these are the common herbs easily available surround us. So just we can include our food. And next one is try to avoid the fast food, junk food, like fried food. The food is directly fired. That black color particles, right? The charcoal particles or black color particles that will cause the develop the advanced glycation in product. So when the patient suffering diabetes, once diagnosed, then need to face multiple challenges, including that will lead to heart problem, lead to brain problem, nervous and kidney, eye, everything. That's why. So just we need to practice good food habit as well as simple exercise or to increase the physical activity. By the way, we can prevent. But if you consume these normal herbs, it's not herbals, it is a natural product. If you consume, if you include our diet, then easily we can prevent these metabolic syndromes.
Okay, thank you. So besides we try to develop the new drug for the diabetes, but the most important thing is how we can prevent the development of this disease by improving our lifestyle.
Yes,
Okay.
exactly.
Thank you, Professor. And another question is from Fanny Stefani. I ever read an article about the Traditional Medicine Global Summit on August 2023 in India. Is that mean that herbal treatment had been fully approved by WHO?
Means, Prof, the herbal medicines fully approved by WHO.
Mm.
Yes, nowadays the Ministry of Health or WHO or FDA, they can approve the product for the treatment of particular disease.
So the herbal medicine is legally the approved alternative product to cure or treat these various diseases, right?
Yes, actually the crude extract for the as a traditional medicine, where you want to register your product as a traditional medicine, yes, you can go with the traditional medicine. But however, these agencies, these authorities, they are expecting the preclinical and clinical data. If they satisfied with your outcome, the therapeutic efficacy in terms of safety profile, then definitely they will approve your product. There is no issues. But for example, the well-known example is the metformin. Metformin is one of the popular medicine for the treatment of diabetes mellitus. So where the metformin is come from? Metformin is isolated from the herbal extract. Metformin is a natural product. The active ingredient metformin is obtained from the natural product. So now the metformin is used worldwide, approved by WHO, approved by FDA and all the authorities. Why? Because metformin is previously prohibited by FDA due to some toxic effect, some unwanted effect. Later, the molecule is modified, chemically modified. Now used to as a diabetic, anti-diabetic drugs. So no issues. The thing is, if you want to register our product, if you want to approve our product by this authority, we need to produce proper preclinical and clinical evidence. Without evidence, we cannot get any approval. We cannot use the particular compound. We cannot sell the particular compound in the market.
Yeah, because safety is the first concern in pharmacy, right? So the research
Yes,
has
Prof.
to be conducted. Okay, thank you, Professor. And last question, maybe, although there's another question beside this one, but due to the time limited, I will call this the last question from Jajang Jafar Sodik. He is our magister student, and he is particularly intrigued by the section on nanomedicine for the FU, where it is mentioned that silver particle embedded in cellulose nanocrystal isolated from Syzygium cumini leaves have accelerated wound healing in diabetic mice. Incidentally, his thesis focuses on formulating curcumin compounds into nanocurcumin preparation for wound healing also. According to the research result, curcumin formulated as nanoparticles perform better than those not formulated in nanoform. Professor, and he would like to ask about how the development of nanomedicine, especially the use of nanoparticle in the treatment of diabetic foot ulcer, can be integrated with the effectiveness of traditional plants identified to have healing activities. And what are the main challenges and collaborative potential in improving therapy outcomes for patients? Thank you.
Okay, Prof. Means how this nanoparticle, how to develop this nanoparticle? This is the question, right, Prof?
Yes.
So nanoparticle production is very simple in case of preparation. There is different techniques are available for the development of nanoparticles. For the easy understanding, just I will give some example. Means if you know the coarse sugar, if you size reduced with the like maybe with the help of mortar and pestle, you will get the fine powder. Means big particle take more time to dissolve in water. But the same sugar, if you size reduced, you change to fine sugar, it will dissolve faster. So more efficacy, more efficiently dissolve. So how we size reduced? With the help of mortar and pestle, just size reduction. Same like the stirrer or pulverizer. So means put your bigger particle or coarse particle. So if you size reduce it, you bring down to nanometer scale, that product is called as nanoparticle. Right? So different techniques are available, different instruments are available, like homogenizer, like ultrasonicator, like spray dryer. So these are the instruments used to manufacture nanoparticles, like a nanoemulsion. We know how to prepare emulsion. If the globule size is reduced to nanometer scale by using this homogenizer, that is called nanoemulsion. Then you put into cream, that we will call hydrogel or nanogel. Then easily we can apply to the own area. That's it. So the globule size. So how to reduce globule size? With the mortar pestle, we cannot size reduce to nanometer. So prepare coarse emulsion. Then this emulsion is to be exposed to this ultrasonicator or homogenizer. This will size reduce the globule size into nanometer scale. Then this nano emulsion can enrich into the traditional cream. Then we can apply to the own area. So we can get better therapeutic effect compared with the traditional cream.
Okay, thank you, Professor, for your concise answer. I hope it will help Jajang in finish his research now. Okay, maybe we have reached the end of the end part of this event, and please allow me also to take some highlighted points from this today's session. Despite the fact that there has been a lot of research on medicinal plants and they have been shown to have some activity, investigation on the mechanism of action are still quite restricted. And aside from that, there are still limited active chemicals isolated from the medicinal plant. And even though a few polyherbal formulation has been documented, there are relatively few marketed treatments available from alternative medicine to treat the DFU. And this is maybe can be a good news to us as a researcher, because these are a few of the research gap that is needed to be explored. And many thanks for the Professor Satheesh. I really appreciated your willing to share with us and all the audience for the answer. I'm sorry I cannot read all the question from the audience, and hope to see you again in the nearby future. And thank you very much. Over to you, Ms. Gihad. Thank you, Professor Satheesh.
Thank you very much.
Thank you very much, Professor and Mr. Widya. Alhamdulillah, the presentation has drawn to a close. Don't forget, valued participants, to do the quiz and questionnaires and the absence to get your certificate. Marking the conclusion of our event, as we wrap up, we have the announcement regarding the fortunate winners of our door prize. I'd like to mention Sir Denny, Sir Habib Nur Abdul, Miss Fenty Stephanie, and Sir Dajang, myself. Winners are encouraged to reach out to Miss Shifa Salsabila to claim their well-deserved prizes. With the conclusion of all the segments of our event, I extend my heartfelt gratitude for your attention and participation. I apologize for any inadvertent oversights or mistake. Thank you and goodbye. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, thank you for all.
Thank you.
Thank you, Prof. Thank you, everyone. Thank you for the
Thank you, Professor Satheesh.
organizing
Thank
committee
you.
for this wonderful event. Okay.
Inshallah.
See you again.
Thank you, Prof.
Hope to see you
Satheesh.
again.
Thank you, Prof. Thank you, everyone. Thank you, all
Thank you
attendees.
very much.
Thank you for Widya and Gihad.
Thank you, Prof.
Thank you.
Thank you for watching.